All righty. Good morning, everybody. Thank you so much for being here today. We've got a great webinar with some fantastic speakers here to talk about how we're strengthening youth mental health access across the state as a statewide approach with regional voices through our Kids Mental Health Washington program. We've got a lot to cover, so I'm going to go ahead and get started. So thank you so much for being here. My name is Gina Capadu. I use she, her pronouns, and I get to be one of the program coordinators with Kids Mental Health Pierce County, expanding this across the state as Kids Mental Health Washington. So I wanted to give you just an overview of what it is that we're going to be covering today. Here is our agenda. It's pretty packed. We got a lot of great work that we want to elevate and showcase. Just a few housekeeping pieces. Please do use the Q&A. We did make a last minute decision where we decided that we were actually going to allow the use of the chat just to make sure that we could enable more access. So please know you can use the QA, you can use the chat. And then we're also going to be making this interactive. So we're going to be dropping some links for some Mentimeter and some forms so that we can get some input from you all just to uplift all the great work you're doing. And then we're also going to have opportunities to close with frequently asked questions as we have time. And if we run out of time, just because we have so much information to share, we will be able to follow up as needed. So that's our agenda and our housekeeping pieces. The objectives that we wanted you to cover today is we wanted you to walk away with a few things. Is first, we want you to understand what the Kids Mental Health Washington model components are. Second, we want to give you a face and a contact to be able to get connected towards your regional local people. Third, the big meat and potatoes of today is being able to present some data, be able to interpret it, and then apply it together. And then last thing is that we're going to put you to work. We've got a call to action because we want to partner with you and be able to elevate our impact. So that's what we're covering for today. So we're going to use our very first piece of giving everybody going here. So what we're going to start with is a Mentimeter. If you've used Mentimeter before, great. If not, no worries. I'm going to do two things. I'm going to be dropping a link here in the chat. You're going to click on that link and then you're going to input a code. So here's the first link. And then you're going to input a code, and we're going to be asking three things from you today in this first polling opportunity with Mentimeter. So first and foremost, you're going to see a question about what system or partner are you representing. Second thing is going to be about what county it is that you're serving. And last, we're curious about the barriers to care that you're experiencing for youth behavioral health. And that could be either something you've experienced directly, or it could be what you're saying on behalf of the clients that you get to serve. So I'm seeing some responses come in. That's always a good sign to me that technology is off to a great start. And so I'm seeing that we've got people from schools, healthcare, the Native Project. I'm seeing we've got behavioral health admin service organizations. There's youth collaboratives that are here today. We've got a lot of different people. So that's exciting to see. So as those responses come on in, I'm going to move us to our next question. So you should be able to see a question now asking about what county it is you're coming for. I'm actually coming from you from Pierce County, and I'm saying that we've got people all over the state, which is exciting. I'm saying Island County, Cowlitz, we got some King, we got up north with our friends in Snohomish, down south in Clark. I'm seeing some statewide call outs, so that's pretty exciting. And our very last question today, what barriers to care are you experiencing, either directly or in the services that you're providing? I also wanted to call out, I know some people have issues with Mentimeter, perhaps because of organizational firewalls. Sometimes it's just that the weather's not cooperating with us right now. So if for whatever reason you can't use the Mentimeter, I'm also going to be keeping an eye on the chat so that we can see those. So thank you to those of you that have been able to have that information dropped in the chat. But for our last question, I'm really excited to see that many of you are speaking to some of the barriers that we're going to be addressing with the regional presentations we've got going on. One of the big ones I'm seeing is care coordination. Another one is insurance barriers or resource limitations based on the region and the insurance type. I'm also seeing a lack of substance use disorder services, the intersectionality with youth on the spectrum or people with developmental disabilities, and then also the needs of younger youth that are starting to become more acute, but there's just not those intensive care providers available for them. So thank you so much for being able to answer that Mentimeter. We are going to address some of those barriers. I'm also just really curious for those first two questions about who's in the room with us and where you're coming from, because what Kids Mental Health Washington is really passionate about is serving all youth across Washington state. And we really have to do that in partnership. And you all have so much expertise and skills that you bring to this field that we're excited to have you here. So I just wanted to orient us a little bit to the youth mental health landscape. I think this is pretty familiar to most people, but we know that youth behavioral health access and services in Washington state, it's a little bleak right now. So we've got some resources here. We'll be able to share these PowerPoint slides out so that you can see the reports that we cited this from. But I think some of the important parts we wanted to call out is that Washington is ranked number 35 for overall mental health outcomes. And then it's ranked number 47 when we're thinking about access to care measures specifically. And then when we really dive down into the youth specific data, Washington is actually ranked number 39. And it does cite from all the research that we pulled for this, a lot of those barriers that you all have called out, right? The insurance coverage being a big one, needing care but not being able to get it. There's cost, there's workforce shortages. So we are saying that what the data is telling us are barriers, you're also experiencing directly in the work and the communities that you're in. Other things that we've really considered about when we're talking about youth behavioral health, where are we getting the information about what the barriers are and what do we do with it and about it? And our teams across the state, we have 10 teams that are broken into regions, but what looks like behavioral health in one area, say perhaps Pierce or King County, is going to look different than maybe a rural community or somewhere more south, like maybe perhaps Southwest or our friends in Clark County that make up Southwest compared to what it looks like on the other side of the mountains, like our friends in Spokane and Spokane County. So for those differences, yes, we want to look at what it says across the state, how Washington's faring, but these are also examples that we tapped into local data to be able to see what are the youth needs that are regional. So we're making sure we target our efforts towards the needs of our local communities. So I just wanted to give a high level overview of what the Kids Mental Health Washington model is. So for those of you that are brand new to working with our teams, you've got a little bit of a concept of what it is that you're able to tap into. So first and foremost, we're very proud to say that this is a partnership between our friends at the Healthcare Authority, Developmental Disabilities Community Services, formerly known as DDA or Developmental Disabilities Administration, and our 10 regional Kids Mental Health Washington teams. Kids Mental Health Washington, who we serve, is going to be all youth, kindergarten through 12th grade. We've served as young, primarily as 1, all the way up to 25, but we do tend to focus on kindergarten through 12th grade. I want to share that if you have a youth that maybe falls outside that range, please refer to us anyway, and we're still happy to be able to do what we can to support. The other thing I want to uplift is not only do we serve primarily kindergarten through 12th grade, it does not matter what insurance type they have or if they have no insurance at all. Maybe they're dually covered with insurance. We will serve all youth. The last thing I want to call out about who we serve is that we really do serve all youth, regardless of their acuity. So it can be something as simple as a referral for like an evidence-based parenting program. Maybe it's a non-clinical response, like being able to get some coordination with like a Boys and Girls Club membership. So we've got some of that activity and some safe caring adults that this youth has access to. But we also go all the way up to the most intensive end of the care continuum, like the long-term inpatient programs for youth. That's who we serve. That's the acuity that we serve. And that's the demographic of insurance, no insurance, doesn't matter. We still want to serve the kids, whether it's clinically or non clinically. And how we do that is with 4 key pieces. So, first and foremost, one of the big things that we do is behavioral health navigation. So, you all deliver really great resources within your communities. We want to partner and make sure we can get families connected towards those. So, we will provide direct behavioral health navigation to do the warm handoffs and the connections towards resources. Second thing that we have is sometimes there's a lot of systems involved, or there's a lot of partners, or it's a really complex case. We can convene what we call a multidisciplinary team. And with that, what that is we bring the youth and or the caregiver to usually a virtual space, and we bring all of the relevant partners, whether it's about safety strategies, behavior management strategies, family engagement, outpatient service navigation, whatever the ask is. We have community partners that will come to the table with the youth and or the caregiver to say what are the needs, what are the resources, and what recommendations can we make. And then the Kids Mental Health Washington teams are going to follow up to make sure that those recommendations get some follow through. The third thing that we have is local steering committees. So we have leadership representation on local steering committees that includes child welfare, juvenile justice, hospital, community-based youth programs, schools. peer partners to be able to say what are our initiatives that we want to drive forward as a community in collaboration. And the last thing that we have is a regionally maintained website of resources for behavioral health. It's like a one-stop shop that we update on a very consistent basis, at least every other week, I would say, to make sure that there's relevant information. Because what we hear a lot is families don't need another door to an empty room. We want to make sure that the resources are current and that they're relevant. So that's what Kids Mental Health Washington is. We've done previous webinars about how we came here and how we've expanded over the last 3 years. We have information that's cited in this PowerPoint of how you can access that for past webinars. This webinar is really about what's the data that we've collected in the last 2 years of being fully stood up. And so that's what we're going to focus on today. But if you're interested in that information, don't worry, we've got you. We've got a way for you to access that later. So this is what we really came for today, is to talk about the data. So I'm going to talk about some of the numbers that we have and some of the themes and trends. And then I'm going to be turning it over to the 10 Kids Mental Health Washington regions, as well as our partners at DDCS, or Developmental Disabilities Community Services, one of our other partners in doing this work, to talk about data is great as we've been collecting it and as we've been doing services. What does it mean to us and what are we doing with that data? So we're just going to jump on in. So a couple of things that I wanted to call out is we're going to be doing a year-over-year analysis. So we have 2 years of fiscal year data that we're going to present to you. So we've got 1 year of data that's going to be on the left-hand side of your screen, which is from June of 2023 to July of 2024. And then we've got our most recent fiscal year, which will be on the right side of the slides, which is July of 2024 to June of 2025. A couple of important considerations I want to be able to set the context for is, first and foremost, we started a tiered rollout process 3 years ago. And so we had 4 teams that started with the first year rollout. And then we had 4 more teams that came online. And then we've had our last 2 years, our last 2 regions, come online in the last year. And so for this year over year analysis, the numbers are going to grow because we're able to have more partnerships and more referrals and more service connections. And we've got more team members that are doing this work across the state. We are going into our first full fiscal year of having all 10 of our teams stood up. So we're going to have more data present in the future. So we're very excited about that. I see claps. Thank you. I'm very excited as well. The other thing that I wanted to call out before I fully dive into this data is you'll see that there's a general referral for all and what the data looks like for every referral that we've had. And then we also call out for those that have risen to the level of a multidisciplinary team, or an MDT. And what that means is that these tend to be the cases that have more acute needs and we have multi-system involvement. So we wanted to look at what's the difference between a family that just might need a quick referral for perhaps getting connected to like a care coordinator through their insurance, where they just need an outpatient provider, they need help making an appointment, getting in the right direction. That's one case. But we also have youth that can have more acute needs, that can have more complex involvement, where child welfare, juvenile justice is involved. And we need to have multi-system coordination to make sure that's what's happening in schools, is happening with service providers, is also aligning with what families need within their own homes. So I wanted to call those pieces out. And with that, I'm going to go ahead and jump into the data. So from June of 2023 to July of 2024, again, that's our first fiscal year. Our second fiscal year is July of 2024 to June of 2025. And so what that means is we've had really big growth over the 2 years. So for our first fiscal year, we had 352 referrals. In our second fiscal year, we actually had almost doubled that. What was interesting to us is when we think about those multidisciplinary team meetings, those MDTs, the youth that tend to be more complex and need staffing, they need staffings for multi-system coordination. We really don't have that many more. And I want to call out that that's actually a win for us, because I think it speaks to the skills of our Kids Mental Health Washington team members in being able to provide behavioral health navigation to get youth and families connected towards the great work that you're doing. So not every case is going to rise to a multidisciplinary team, even if there is that complexity and there is multiple systems involved. So I wanted to call out that that's a win. The other things that I wanted to call out is that we have, on average, our average referral is going to be for youth that are about 12 to 13 years old, and that's for both fiscal years. And then we also have a really big age range. So you'll recall that I said that we cover for Kids Mental Health Washington primarily a kindergarten through 12th grade population. We have had as young as 1 all the way up to 25. And then the last thing I wanted to call out is our age range for the youth that we tend to host our multidisciplinary team meetings for is going to vary anywhere between the ages of 4 all the way up to the ages of 21. So some more fiscal year side-by-side analysis that we wanted to show is the system involvement for the kids that are being referred to us and that we're serving. And so it looks pretty similar when you look at the child welfare for all the referrals. Same thing with our juvenile justice and our developmental disabilities administration youth. We do know that it's been transitioning as an agency to DDCS, Developmental Disabilities Community Services. But for our data tracking purposes, we wanted to stick with the language that was used, which is why it says DDA. So you'll see that they're actually pretty similar year over year, except for the difference in child welfare. We don't necessarily know what the causality is of why we have a jump in the youth that we're serving being child welfare involved, but it's something that stood out to us that we're going to keep an eye on moving forward. Another metric that we wanted to break down for you all is the insurance breakdown of who we're serving. So year over year, it's actually pretty consistent. We've got the majority of our youth, so about a little over 2/3 are going to be Medicaid. And then for our commercial insured youth that we're serving, it's going to be about a quarter-ish. And then for other, we wanted to call out that the other category is going to include the youth that are dual insured. So maybe they have Medicaid and a secondary commercial provider. Perhaps they're uninsured, they have military insurance, or they're tribal. So we wanted to call that out. And then another thing is when we look at our referrals overall for the insurance breakdown versus the insurance breakdown for the youth that tend to rise to that multidisciplinary team meeting level, it's about the same. Medicaid has jumped a little bit in the last year. Again, we don't know exactly what the causality of that is, but it's something that, again, we're going to be keeping an eye on moving forward. What has stayed fairly consistent is year over year for this fiscal year data breakdown. What we have found is that the top reason that people are referring to us, these are the top three, is that it stayed consistent that the number one reason that we need people to refer to us, or people have needed to refer to us, is because of outpatient service navigation. We then be able to break it down to care coordination and then behavior management strategies. And then when we look at the top reasons for our multidisciplinary team meeting, it stays pretty consistent there as well. I will also call out that I see in the chat that there is a little bit of a typo in the fiscal year timeframe of June versus July and then July versus June. It is that full fiscal year. I'll own that part where it's actually going to be a fiscal year of starting on July 1 and going through June 30th. So if that's throwing people off, you caught that, and I apologize in advance. So the other thing that I wanted to call out for our data, and then very quickly, I'm going to talk about some of the newer metrics we've tracked, and then I'm going to turn it over to our regional partners so they can share what it is that they're doing with that data as Kids Mental Health Washington, but also the difference that it's made for you all as partners within your own local regions. So one of the things we wanted to call out is that our top referent for the first year that we started collecting data was our schools, our system partners, and then parents or caregivers. And then in our last year, it's really been system partners, schools, and hospitals. So when we call out system partners, we're talking about anybody that's like in juvenile justice, child welfare, developmental disabilities, community services. That's what a system partner is to us. And that stays pretty consistent when we look at our top referent type for our multidisciplinary team meeting as well. So for our insights, the last thing that I wanted to talk about before I turn it over to our regions to speak to some of the ways that they've been using this metrics across the state is a couple of pieces. Is our top recommendation that our teams have made for the behavioral health navigation they're doing, the consultation, and the multidisciplinary teams that they're hosting is to provide that consultation information about community-based services, usually for a higher level of acuity. And that's going to be like our WISE, our wraparound services, things of that nature. And then our second thing is that we're providing just general behavioral health information because there's a lot across the care continuum. So people are interested in just learning more. And then last but not least, we wanted to uplift that one of the big recommendations that we've had is just providing information about our crisis and stabilization services. And then with the outcomes of that, we started tracking what the outcomes are for the families that we're serving and the services that we've delivered. And we wanted to call out two things, is that families are actually getting engaged and connected. It's not just a referral that's happening. There is an intake that's happening. They have a contact, so they're having an effect there. And then the last thing is that they're getting connected to other great systems that are already doing this work because we don't want to be duplicative of what's happening in the communities. We want to get people connected towards what it is that's available for them. So what I'm going to do next is I'm going to turn this over to our 10 teams at Kids Mental Health Washington across the state so that you can get to meet them locally. And then they're going to do a couple of things. So not only are you going to get to see them and meet some of their team members, they're also going to give an overview of how they're using the state as Kids Mental Health Washington as a program, but also those community partners, perhaps through like their steering committees or their multidisciplinary teams. And then we're also going to talk about like a trend or a gap that they've been able to identify in their community. And then last, we'll close out with like a light or some capacity that's been added. So I'm going to turn this over to our next group of presenters. And so we've got first up is our friends at Greater Columbia. So I'll turn it to you.
Hi, good morning, everybody. My name is Meredith, and I am over at GCBH and have an amazing team here with me. I am the care coordinator for our Youth Access and Resource Program, which we affectionately call YARP. We have an amazing program administrator, Gordon. We have another amazing youth navigator, Zach, and Roberta Ellis is our other fantastic youth navigator. So we are so excited to be here and to be able to present and talk to you all today about YARP and all of Kids Mental Health Washington. So as for us, when we looked at some of the data and what we did with some of the data that we kept seeing over the past couple of years is that we saw that most of our data came from referrals from schools. And to improve referral rates in lower referring counties, we did a targeted outreach. And so we did travel across our 9-county region to meet with school staff, to introduce the YARP program, and to really just make connections with others in the various schools across our large 9-county region. There's definitely a team effort, and I think it was really effective. We've started to get more referrals from counties that are just outside of Benton and Franklin. So that was one thing that an impact that our data had on how we do things over here at Greater Columbia. Another thing that we have done with the data is in Benton and Franklin counties, they're developing a new recovery center, and that is funded by the 0.1% sales tax. So based on the steering committee identifying a gap in WISE services for youth with private insurance or no insurance, as these services are currently not available in the Greater Columbia region, we have discussed potential use of some of this funding with several members of the Bi-County Advisory Committee and several interested parties. And there is a lot of interest in those we've talked to about trying to get a WISE team put together for our non-Medicaid or uninsured youth. Right now, the Recovery Center Committee is not accepting new proposals until the facility is complete, which I believe will be sometime maybe in the next 6 months, I think. But once that project moves forward, we definitely want to continue to pursue working with the Bi-County Advisory Committee to try and get a WISE team put together for those youth that don't have Medicaid. So we are actively working on that. One of the trends that we have seen is that there's definitely a need for education about services for youth diagnosed with autism and other IDD conditions. In our region, we continually encounter misinformation about services, misinformation about ABA availability, including eligibility ages as well as service options. To address this, YARP has been really focusing on connecting with school staff and families to appropriate resources such as DDS services for eligible youth and linking families with insurance care managers who can help them locate in-network providers. Because ABA services and DDCS assessments often involve long wait lists, we also work to bridge the gap for those youth that are waiting for services by coordinating with our amazing youth mobile outreach teams, as well as school supports and community organizations such as ARC. Hope, PAVE, and Parent to Parent to help support families as they navigate those systems and as they wait for services for their youth. And lastly, I will just kind of mention that a way that Kids Mental Health has added capacity to our community is that our wonderful partners at ESD 123 had maintained a provider list for Benton and Franklin counties, but it was not regularly updated and did not include the other 7 counties in our region. YARP was able to partner with ESD to develop a comprehensive monthly updated provider list for all 9 counties. We have that on our website. This provider list and the YARP website are now linked across multiple school districts, county health departments, community partner sites, and that helps to improve access to information and helps youth and families connect to services more efficiently. I think one thing that we have seen a lot of is families say that they're really frustrated that they keep calling and trying to get services for their youth, only to, either not get a call back or not be able to access those services. And we have found that our Find a Provider list has been very beneficial in assisting families and providers with showing some of the providers that are available and that are accepting youth and accepting their insurance. So please, when you have a moment, take a look at our Find a Provider link. We could not do it without the assistance of ESD 123 and our amazing YARP team here. It really is updated monthly, and we're really proud of it, and look forward to continuing to be a part of Kids Mental Health Washington and serving the needs of our youth.
Great. Thank you so much to our Greater Columbia team members. Really appreciate it. I'm going to turn it next to our friends at Southwest. I'll let you all take it from here.
Hello, good morning, everyone. I'm Brooke Veo. I'm the program manager for the Southwest Washington Youth Navigator teams. I also oversee our North Central teams, and I will introduce them a little bit later when we talk about North Central. So I have 2 amazing team members here in the Southwest region, Taylor DeFries and Charity Joy, and they do the great amount of work with our youth and families that are referred to us. And so since we started taking referrals in March of 2023, we've received over 500 referrals in our region. And I'm really proud of our ability to hold frequent multidisciplinary meetings in our community. We do those every week, sometimes bi-weekly if we're really busy. And our team, our community members show up and support our families at a really high rate, and we're really proud of them and all their work that they have done for our kids in our community. The Southwest region, we've fully implemented a pre and post assessment for the youth and families that fully participate in our program. So from start to finish, usually they're with us for about 90 days. And I just wanted to share one example from our data. We've shown that within participating with our program, the kids in our program have reduced school avoidance by 37%. And when we looked at the data for kids coming into our program, 76% of those youth indicated that there were issues with school avoidance. So we saw a pretty big drop in that, just from getting connected to those resources, with us working with schools, maybe doing a multidisciplinary team meeting. And families also indicated that they felt a lot more hopeful once they went through our program. So that's been one of the really exciting things that we've seen from our data. So our highest referral source in Southwest is schools, and we've really focused our effort on supporting our Southwest school districts. So Taylor DeFries is one of our outreach specialists. She has been really instrumental in getting schools on board with our program. And she recently started back in April of this year a school collaborative meeting, and that happens bi-monthly. It's a way for us to expand our action meetings to reach a broader audience and make sure that our school districts are feeling as supported as possible. They are able to come to that meeting and really talk about the trends that they're seeing within their schools. We bring in speakers to talk to them about things like school avoidance and ways that they can get extra support from their community, because we don't want them to feel alone. So within that, using that data for our partners, we've really seen our community come together and focus their efforts around school avoidance and other things that they're seeing within their school, such as suicide prevention. Charity and I recently attended a meeting where there were over 90 kids and families that came together to discuss suicide prevention within one of our bigger school districts. And it's been really awesome to see our partners get to know each other and show up to those events. And so families feel that, and then they know where to go to get that support when they need it. So a trend or gap in our community, we have many of them, as do all of the regions, but one of the things that really has stood out to us is in our rural areas of Southwest, so especially Klickitat County, we lack any in-person WISE services. And so that has been a really difficult thing to navigate for us. And Charity and Taylor have just really gone above and beyond in making sure that those families are connected to the services that they do have available. So in the case that we have a family that lives really off the grid, so off the grid meaning they might not have internet or things like that, we are working with schools and other services just to make sure that they are feeling as supported as possible. So one of the ways that we've added capacity to the community is we've really worked to establish personal connection with our virtual services, such as the View and Charlie Health. And when I say personal connections, we have them on speed dial. They come to all of our meetings. We're meeting with them frequently to make sure we're up to date on what they can offer. And we're coordinating back and forth with them around the clients that we serve. So these virtual services have been really crucial in connecting families to much needed support in those rural areas. And we're also just really frequently updating our websites and sharing resources and flyers directly with those communities so that they don't feel so alone in connecting the families that they're working with. And I think that is all I have for Southwest. Thank you so much.
Great. Thank you so much, Brooke. I'm going to turn it next to our friends at Salish, and then we'll hear from our friends in Thurston Mason region. Go ahead.
My name is Stephanie Thielen, and I am with the Salish region. And for those of you who may not know, that includes Kitsap, Jefferson, and Clallam counties. And in our region, we call our program SYNC, and that stands for Salish Youth Network Collaborative. And for staff, we have me. I am the Children's Program Manager, and then Jessie Parsons is our Program Coordinator. You'll get to hear from her in just a moment. In early next year, hopefully in January, we will also be recruiting for a second program coordinator as we're growing and have a big outreach plan and some big goals for next year too that you'll hear more about. I'm going to start with a trend or gap that we've noticed in our region, and really what we are seeing is younger and younger children reaching out with more intensive needs than before. And I think, as we all know, as we kind of move up the ladder in terms of intensive services, they become pretty limited, especially for younger children. There's just not a lot of places for them. So I'm going to turn it over to Jessie, and she's going to share with you what we're hoping to do with that to address that in our region moving forward, to try and reach children sooner before they're needing those crisis levels and intensive levels of care.
Thanks, Stephanie. Hi, everyone. So I have had the privilege of being a part of the SYNC team since we launched in 2023. So getting to see that data growth and what youth we're serving and the families and the needs in our community. And so Stephanie and I and the rest of our team, something we have talked about recently is the acuity of our youth that are coming into the region and making sure that they're getting support that they need. So some of the outreach specifically that we want to kind of target from that data is being able to address those needs before they reach that acuity level, before they're interacting with our crisis teams or they're going to the hospitals. We want to meet them in the schools. So our big plan for this year, or for 2026, I'm sorry, is to do a lot of really targeted outreach with our schools, making sure our student assistance professionals know who we are, know that they can give us a call. Because I'm sure you guys are aware, school staff is just inundated with so much going on and they have so much on their plates. And if we can help give them a resource or point the family in the right direction, we want to be able to do that to try to mitigate them reaching such a high level of need, especially for our younger kiddos who, one, are just so young and probably don't have those services out here that we need. So we'll be reaching out to those schools, to the social workers, and trying to work closely with our the OESD 114 to make sure that we're building on those relationships that we have cultivated over the years, making sure that that's being represented in kind of those needs. We have seen some direct correlation between our outreach and our referrals coming in. We're hoping to see that coming in 2026 as well. And something we're seeing with this outreach and this continued commitment to our community as a regional improvement and kind of a spotlight specifically is I'm not sure if how many of you are very familiar with the Salish region and these counties out here, but our region is actually broken up by the Olympic National Forest. So some of our biggest cities are very spread out. And while we do consider a good portion of our area rural, a good portion out in Forks and up where our tribal partners are in the Nia Bay is actually considered frontier. Many of them do not have the ability to drive out to Port Angeles or Porter to receive services, or there just are not services in that area. So something that we have found a lot of strength in is being that point of contact for a lot of those areas. We've been able to cultivate a lot of relationships, not only with ourselves and these providers, but especially amongst each other, that they might not normally know that that program exists, or they're very siloed in, like, this is what we know it works and this is who we know to contact. But maybe they don't know that 20 minutes over the line that there's a provider that would work for them and that they would be able to support. So between our FIST program, or the Family Youth System Partner Roundtable, and our SYNC program, and just our steering committee, we've been able to cultivate a community that's based on, one, meeting in person and meeting our families where they're at, but also meeting our providers or where they're at. Something I get asked a lot is like, where's your office? Well, my office is based in Port Orchard, but my office a lot of times ends up being my car or the library or the courthouse. It kind of just depends on what our families and our providers need. So we make ourselves available, and it would not be the first time that I've ended up in Forks or Nia Bay supporting a family and a provider to make sure that they know that we're willing to go there for them. And that is something that we've continued to cultivate, and we hope to continue to grow into 2026. So unless there's anything Stephanie wants to add, that is all I have, but I appreciate you guys all being here.
Great. Thank you both very much. I'm going to turn it next to our friends at Thurston Mason region, and then we'll hear from Spokane.
Thank you, Gina. 1 second. My name's Kelly Monti. I'm with the Thurston Mason Behavioral Health Administrative Service Organization. I'm a program coordinator with our Youth Navigator program, or YMP. Our team includes one other program coordinator, Alicia, who's on here with me, and our program manager, Gary Enns, and we have an admin support person that has part-time support for our team, and that's Luke. Our team highly prioritizes data collection and presentation with our teams and stakeholders. We're closely monitoring local data as well as statewide data to help inform stakeholder recruitment on various teams. We have a steering committee, our MDT teams. We have an advisory team that's helping us out. And from those teams, we've also developed multiple action teams to address some of these gaps and needs in our community. We're also using data to, or including our strengths and needs survey that we did when we started the rollout of our program, key informant group interview data, again, tracking our referral data on our deliverable reports, our MDT data as well. And again, using all this information to really inform the types of services and supports that we're providing, very similarly to the teams that you've already heard from. Some examples include our recognizing the need for that families are experiencing concerning or just needing to connect with services earlier in a youth's behavioral health journey. We are seeing a lot of requests for high complexity needs, a lot of various system involvement, and are trying to identify ways that we can connect with those youth earlier. So we've developed an action team, our early recognition and intervention team. And one thing that's come out of this team is that we supported a 3-part podcast series on community activated prevention. And this is in partnership with the Family Education Support Services, as well as the UW Social Development and Research Group. We had an interviewee from their team, and the podcast is called The Parental Compass. So we are happy to put out some education and information on prevention work and really attachment and connection within families and communities. Another trend we're seeing is similarly as mentioned before, regarding youth who have intellectual or developmental disabilities and really needing a lot more services or supports than they're kind of actively getting in that moment. So we have another action team called our Co-occurring Behavioral Health and Intellectual and Developmental Disabilities team. Our team was able to support training for some of our local behavioral health agencies. We know some other agencies within our region have participated in training in RUBY training, which is Research Units in Behavioral Intervention. And our hope was that this training would help enhance the treatment and care, enhance tools to provide for those providers that are already supporting a youth with these needs at all different levels of care. So our team has been very lucky to add value to an already robust system of care established in the Thurston Mason region. We continue to be impressed, very appreciative of the ongoing community engagement in this work, with our goal of really enhancing the existing system of care. Our program has been a consistent and comprehensive touch point for behavioral health navigation, while many members of our community were already doing a lot of this navigational work, maybe with time and energy that they didn't have. And so we're happy to pick up this work and really spend time with families with that care coordination piece. Finally, one of my favorite things and a huge strength of this Kids Mental Health Washington program is just the ability to connect families to cross-regional teams. So to be able to reach out to talk about a situation with someone else for a family that either is moving to their region or, all different kinds of situations. But we always have a face and a name to hand off to, and we know the youth and families that we're talking to are in good hands when we're making this direct connection with our regional partners. So just wanted to share that piece, but that's it for me.
Thank you so much. So I'm going to turn it to our friends at the Spokane region. After our Spokane region, you're going to hear from Brooke again to talk about North Central. We are keeping an eye on the time, so it's really important to us to uplift the regional perspective. And then we're going to share quickly, and you'll see in the PowerPoint slides, ways that we've made impacts across the program statewide. So I just wanted to call that out too. So I'll turn it to our Spokane friends next.
Good morning. My name is Jeanette Haynes, she, her pronouns. I am the REACH program coordinator. REACH stands for Resource Engagement for Adolescents and Children. It's a part of the Spokane County Regional Behavioral Health Administrative Services Organization. Here joining me today is Josh Henderson. He's an integrated care coordinator here at the BHASO. He can maybe answer questions about the rollout of our program or like more systems type questions if there are any of those at the end. He's also covering for our supervisor, Jessica Thompson, who's unable to be here today. Also part of our team is Taryn Kovac. She's our care coordinator. We have Serena Lewis, who is our behavioral health navigator and peer support specialist. Being mindful of time, I'm just going to jump right in. One way REACH uses internal data is to track we have a MST, multi-system team members. We track their attendance at meetings. We also try to follow their recommendations. Are they making recommendations that are going to be beneficial to our youth and families and the population we're serving? And because of that, we've been able to kind of modify who we're inviting. We can add additional members as needed if we see a gap in those recommendations. For instance, we had a mental health therapist from our juvenile detention center join our MST membership. It also helps us to target specific populations for mental health, substance use disorder, our unhoused population, those who are hospitalized or being involved in juvenile justice. It helps us to gather those specific information or resources that would be beneficial to our youth and families. So REACH uses external data to help identify the goals of REACH in the community. For instance, the capacity of REACH. We've gotten a lot of referrals recently, so we need to be mindful that we're able to serve our youth and family the best that we can. It also helps us with the complexity of the acuity of youth in our region and to identify what resources are available and which resources could be utilized more frequently. For example, ABA Therapy Agency has a year-long waiting list when another might only have a 3-month wait list. And we also found out there are virtual options as well. So it kind of helps us to track those things. We also track our referral sources and reasons for referrals. This allows us to track trends and community needs to ensure that the team is knowledgeable about resources to meet those needs. Additionally, through tracking trends, we have information to bring to the steering committee meetings to discuss regional needs and gap areas so we can work together as a committee to address those areas. A trend or gap that we've noticed is with transportation for use to appointments or work internships or something outside of like their medical appointments. Also, which allowed us to be able to then collaborate with our special mobility services to see what programs they had to offer our youth. And we actually invited that person to join our MS team committee. So it helps us to recognize gaps in admission time for CLIP, or if a youth is declined by the CLIP task force or denied access, we can work with that youth or family on resource navigation and care coordination to connect them with the recommendations of the task force committee. And also, if they're just waiting for that CLIP admission, we can kind of help maybe give ideas or resources that can help them from returning to the hospital or engaging in unsafe behaviors. We've also noticed referrals for youth that have already had involvement with a specific agency, and then we are able to connect and outreach to that agency for training and collaboration. So a light that I would like to recognize as part of REACH is the collaboration and partnering with our community agencies and stakeholders. We've participated in care conferences from hospitals, school meetings. We've attended court with some of our youth and parents. This helps us to identify all of the needs. It helps the community agencies and partners to kind of recognize who we are, how we can help. And it helps us to just really focus what we're doing for specific families that have those complex needs. So that's all from Spokane. Thank you.
Thank you so much. I'll turn it next to Brooke to talk about North Central.
Hi, everyone. Brooke again. So I want to quickly just introduce our North Central team. We cover Chelan, Douglas, Grant, and Okanagan counties. And I have an amazing project manager there, Chrisanna Schrabel, and then 2 outreach specialists, Christy O'Neill and Coral Rodriguez. So for our data, we have received over 200 referrals for the North Central region since March of 2024. They hold MDTs all the time there, at least weekly. Lately, it's been multiple times a week that they are holding those multidisciplinary team meetings. They're really placing an emphasis on tribal communities and schools. So North Central region has the Colville Confederated Tribes within that region. And Christy spends a lot of time with staff and youth at the Pascal Sherman Indian School, really trying to figure out ways to get support to that very rural area in Okanagan County. So for the external use of data, we see great need in the North Central region for things such as food and housing. Recently, Christy pulled together our community and convened a community planning meeting to support families experiencing food disparities. So they were able to discuss food assistance and gaps, events and fundraising, and outreach and next steps. So this has really grown to opening opportunities to expand that availability of food in our community in Okanagan County. For a trend or gap, there's been a big shortfall in availability and accessibility of services and resources in that area. And this is particularly noted in Okanagan County. There are virtually no BRS or ABA services to support high-risk youth and families with intellectual or developmental disabilities. So any services that they receive would be virtual, and that can be really challenging when you don't have internet, much less heat or running water. There is a huge lack of just any general youth supports. So that would include things like mentoring or skill development or availability of just positive social interaction in that community. So they've been able to pull together meetings with community partners to brainstorm ideas and creative ways to support youth and getting them non-traditional forms of counseling through sports and arts. We are really fortunate that in North Central, we have Coral Rodriguez, who is bilingual in English and Spanish. She spends a lot of time interacting with youth and families in our Latino communities. They love her and adore her and call her for support all the time. We have held 5 MDTs in Spanish with Coral's assistance and with an interpreter, although I will say Coral does a large amount of the heavy lifting with making sure that those Spanish-speaking families feel supported in our meetings. We've worked closely with partners such as the Peacemaker Circle to engage with our tribal youth and elders. And that has been just really exciting to see. Christy and Coral have done a lot of work with Tenasket and Wahluke school districts, which are very rural, to make sure that kids are getting to school. So we have kids that live off the grid that may not be able to access things such as a bus stop. So those are some ways that we've gotten really creative in making sure those kids and families have what they need. A light way that we've added capacity to the community, there's been a email listserv developed for each county in North Central, and Chrisana does a really good job of just making sure that each community is getting frequent emails and sharing trainings and webinars to make sure that those families and those community partners feel really connected. Okay, I think that's all I have. Thank you.
Thank you so much. And I just want to call out, I know that we're coming at time, so a couple of things we're going to do to adapt is I'm going to make sure that if you're interested in the PowerPoint slides, I'm going to drop a link at the end so that you can go ahead and input your email so you can get those. What I do want to do is if we run a little bit long, which we probably will, I want to just reiterate that this is going to be recorded. So if you want to hear about the regional differences that are happening, you'll be able to have that. For those of you that have to hop off at 11, we understand, but I want to continue to make space that you can hear from the direct regional contacts about what this looks like in your community and make sure that you can see those examples live. So with that, I'll turn it over to our friends at Great Rivers.
Thank you, Gina. Hello, everyone. My name is Carrie Googe. I'm with Great Rivers BHASO, where we have the Kids Mental Health Great Rivers program. I am the program manager, and I also have on the call with me Mandy Goodman, who is our Youth Navigator program coordinator, and Kelsey Aber, our Youth Navigator. We're really excited. We are a 5-county region. We cover Cowlitz, Wahkiakum, Pacific, Grays Harbor, and Lewis counties. To start off, we are fully operational in all 5 counties as of this summer. We actually completed 1 full year on August 1st of fully implementing, which means accepting referrals. And we're actually at 82 referrals at this point in time from little over a year of implementation. We're very proud of that. There's so much that's already been shared with other regions in terms of how data is used that we share. So I figured I would try to share something that I haven't quite heard just yet, as we do very similar things as other regions with our data. But we are very well connected to our regional FISPERT group in the Great Rivers region that's also under the ASO. And we are sharing our data and comparing notes, and we have formed a collaborative with our FISPERT to try and address what's working well, and then of course what's not working well, identifying those gaps and needs and advocating through the FISPERT channels as well, since there is also a direct state link where voices can be heard. So we really wanted to leverage that program and that connection and also that audience, because that's intended to really gather and obtain the family, youth, voice and choice. So that is something I wanted to share that we are using internally for our data, aside from trying to show at a state level and at a local level of the impacts of the program. Another thing I wanted to mention internally is that, this has been said, but our non-Medicaid population definitely is standing out to us in terms of the data that we're collecting and seeing. It's already been said that WISE services are not available to the non-Medicaid population, and that just keeps popping up for us. So I would turn that into a light to say that having this program, we have been able to work really closely with those uninsured or commercial insured families to really figure out what's in their network and literally navigate that, and be a support for them that they otherwise didn't have or know that they had access to. A trend in gap, again, commercial insurance networks, they have limited access to care based on what those insurance companies will approve or who they're in network with and would approve. So that keeps coming up for us as a barrier. Also, same goes for the ABA providers. It's something that's very much needed and having long wait lists. And so we also make note of that gap. On an observational level, that's kind of outside of data we collect, but just from the feedback that staff have given, finding therapists who are available in person. We also have very rural / frontier areas in the Great Rivers region. And telehealth is wonderful for those that it works well with. And then it's not always the best choice or preferred choice. And so having those in-person therapists that are available has been noted many times, and also the turnover in workforce that has come up for us. And so it can be very, very challenging, even for the Medicaid population. So speaking generally. A light that we wanted to emphasize is that we are trying to well, first we've had a few CLIP inquiries. So for those that aren't aware of CLIP, the Children's Long-Term Inpatient Program, we have been able to help divert some of those CLIP inquiries with families or systems to try and say, hey, can we try the Youth Navigator program first to make sure that you have exhausted all of your resources available to you before we go the CLIP route, which happens to be the highest level of institutionalization for a youth in the state of Washington. So we really want to do our best to serve families and youth in their communities, exhaust all that's available to them through the Youth Navigator program before having to go the CLIP route. Of course, there are circumstances where they just need to go straight to a CLIP committee, but we're really proud in trying to divert that and be a resource that's thought about first before going that route. Another light that we wanted to mention is we're seeing an uptick in parent self-referrals. So that word of mouth and the making note of the flyers that they're seeing in our communities is very exciting to see. We love to see self-referrals very much in that initiation. Also increased school referrals. So that means we're definitely getting an uptick in our school referrals, which is very much ideal for us. So that, I think, based on time too, I think we're good with our Great Rivers update. So please reach out to us.
Thanks, Carrie. I'll turn it next to our North Sound, and then we'll hear from King, Pierce, and DDCS, and then I'll work on closing us out. I know that there's a lot of connectivity issues due to weather. Becky, are you with us?
Yes, hi, I'm still here. Can you guys hear me?
Yes.
Perfect. Well, good morning. My name is Becky George. I am the Youth Navigator Program Coordinator. Our manager, Angela Frazier Powell, and then we also have a navigator, Anna De Los Rios. And our program, we actually just officially launched our website about a month ago, and we are currently taking referrals, and referrals are going well. I know, thank you for the clap and applause. Things are going well, even though we just started. So far, we officially have our Snohomish MDT up and running. We have not had an MDT yet. We did partner with King County to do a joint MDT that went very well. Thank you, King County. Skagit County, we're hoping to get their MDT launched beginning of next year. And Whatcom Island and San Juan County, we're hoping within about the next 4 months to get that up and running. If anybody needs an MDT in the meantime, we will use our regional CLIP committee to do that. And things have been going really well. Feedback that we've gotten so far in the short time that we've been up and running is that our website, while it looks fabulous, there were some kind of kinks in submitting a referral, and our system partners from Juvenile Justice were wonderful about pointing that out and helping us get it fixed. So now submitting a referral, especially with a release of information, is much easier for people to do. We've been getting out and having meetings with county crisis partners, coalition, the different county coalition meetings, and also city partners. and learning a lot, learning about the different gaps that they're noticing in services. We've been meeting with hospital emergency departments, their social workers, and learning about the pediatric bed border data, and also learning it's not the most accurate. And we've actually been able to connect them with a pediatric work group because some of them didn't know about reporting it out. So we're hoping to get more accurate use bed boarding data throughout the region. And then by attending all the meetings and I'm just listening to different people in the community, what we are learning that the gaps so far are youth and families who don't live along the I-5 corridor are really struggling to access services. Transitional age youth in our area, there's really not much for them. Um, if you're commercially insured, you're unable to access WISE. And our children, youth, and family crisis team is only active in 3 out of our 5 counties. And that is where we are at today. So again, we're up and running. Please send people our way. Thank you.
Thank you so much, Becky. I'll turn it to Carson for King County. We'll close out the regions with Vanessa and Pierce, and then we'll talk to our program partner, and then we'll come to a close. Thanks so much.
Thanks, Gina. Hi, everyone. My name is Carson Taylor. I use he or they pronouns, and I am the Youth Behavioral Health Navigator for the King region. Also on our team is Sarah Tapia, who's the Children and Youth Care Manager. Our program lives in the King County Behavioral Health and Recovery Division. We also partner with case managers at Seattle Children's Hospital to facilitate our MDTs for families that are at Seattle Children's that are King County residents. For internal data, we're just up and running as similar to North Sound. So we're kind of in our first several months of full program implementation, but what we've really appreciated is being able to take a lot of the lessons learned from other regions to help us get up and running. So we've been, I think, live with MDTs since July or August this year, and we've done about 10 so far. For kind of some external data, right now we just started a work group. In King County, we have a crisis care center levy that's collecting some funds, and we're going to be launching crisis care centers. There's one open right now that serves adults, but they're looking at opening crisis care centers for youth. And so something we're doing with our partnership with Children's and 1580 and all of kind of local community partners is creating a work group to create some guidance, like a guidance document for those crisis care centers as they open up, to support them in what to do with children and youth who maybe their parents aren't quite ready to pick up their kids. How can we bulk up their support and make sure that they have adequate resources to support families who need support to take their kid back home into the community. Some trends or gaps that we're having. So we've noticed a lack of residential options, like a step between a short-term inpatient stay at like Seattle Children's PBMU versus a long-term CLIP placement. There's just not a lot of those in between options, as well as a lack of training and utilization for a family-initiated treatment. So I've been working with a lot of parents and caregivers that are really struggling with how to support their youth that are over the age of 13, but not willing or ready to engage. So just trying to connect them with peer support and talk through that. And then a way that we've kind of added capacity, we launched our website a couple of months ago. And we're looking, it has a great resource directory, and we're really looking to partner with other resources. There's a lot of resource directories out there, and we want to kind of partner with them to bulk up what we have and make sure it's kept up to date. And then we've also been getting a lot of our referrals early on have been for youth that have commercial insurance. So really providing that care coordination and resource navigation for them is something that doesn't really exist in King County. And so we've been working with them, but excited to keep growing and learning about as we get more data. Thanks.
Thanks, Carson. And for our last region, I'll turn it to Vanessa for Pierce.
Thanks, Gina. Hi, my name is Vanessa Adams, the program coordinator for Kids Mental Health Pierce County in the Pierce region. I work alongside Gina doing the statewide expansion, Ashley Mangum, the director, and then have the support of Karen Tangent, the behavioral health social worker at Marybridge, to do some support with our high numbers of referrals. Since we've been around, I've been in this position since 2022 and could not be more proud and grateful for this program in Pierce. Some of the internal data that we've used has really been focusing on identifying themes and really just seeing some patterns and gaps and using our partners. Pierce has a really rich history of partnering well together. So using the community and support networks that do exist to navigate how we can fill some of those gaps best together. So our team attends the FISPER, our Family Youth System Partnership Roundtable, participates on the CLIP committee, works with the ESD. So we interconnect really well and use that data of where some of these referrals are coming from to really just figure out how we can best support the youth in different spaces in Pierce County, knowing that some of the other regions, as they already touched on, the workforce challenges or some of those lack of resources. Gina shared in the beginning around the ranking that we have for accessing care. Some of the external use of data that we use has really been recognizing the high number of referrals from schools as well as misinformation and challenges with not knowing what to do from the schools. So with that, we developed a behavioral health care continuum and crisis training, and in collaboration with either one or both of our youth mobile crisis teams have implemented training in 15 of our 17 Pierce County school districts, training over 1,000 school partners in the last 2 school years, which has been really exciting and really awesome to see the shift from calling 911 or sending to the hospital to diverting that to using our systems for best practice with our crisis teams has been really awesome. We have collected information from like either behavioral health navigation or MDTs, as well as our action or implementation teams, and really just heard missing, like what is missing, what we need to learn, and developed a lot of trainings and recorded webinars. We've been able to do things like here around not understanding fit, and partnered with Health Care Authority to do a virtual webinar to talk about family initiated treatment, or partnered with our some of our community partners, Marybridge Bridges Center for Grieving Children, to do a multiple part series, as well as some of our ABA and providers to do a series on autism spectrum disorder and developmental disability trainings, because that is, as we talk about gaps, that is one of the gaps that we have seen in Pierce as well, is navigating, supporting our youth with intellectual and developmental disabilities. And so kind of combining those things, the gaps with the trends and the support that we do have in creating a broader network to support all kids, not just some kids. Another gap that we've seen is with youth with co-occurring or either aggressive behaviors or substance use disorder. So one thing that we're really looking on is exploring how to expand our network and utilize community and already developed supports to find places and supports that do exist for these youth, expanding and recognizing some needs for those in-betweens, intensive outpatient, partial hospitalization, and have really advocated for those programs to be in our communities. Have another webinar in that vein about Pierce County multi-care behavioral health developing an IOP, because it was such a high need to have that step up or step down, depending on which direction these young folks are going. So really just providing the support and the connection. If you know me, relationships are huge, and knowing one another and having a place to turn is really important for not just providers, but for families as well. So being that trusted resource and just showing up for these kids is so important, and these families is so important. So the more that we know one another, we can connect youth and families to each other. So that has been a light. When we talk about a light, Kids Mental Health Pierce County has had 3 years in a row now a school-based mental health summit with over 200 educators, mental health professionals, community partners, stakeholders across Pierce County, and brought them together to network, connect, explore ways we can all support school-age youth together from our different lanes. So that's been a light for me in that space, as well as just getting to know the people doing the great work that make up our MDT, our steering committees, our community teams. So that is a little bit about Pierce, and I'm really grateful to you all for being here.
Thanks, Vanessa. And then Dennis, I'll turn it to you to close out our program and regional updates.
Thanks, Dina. So Dennis Trudeau with Developmental Disabilities. I'm the Youth Mental and Behavioral Health Program Manager within the the Systems Integration and Children's Continuum of Care Unit. I work with the Hospital Discharge Program and the 3 youth behavioral health specialists who I will introduce in just a moment. We use the data statewide. We keep data statewide to see how it impacts DDCS clients, much for all the same gaps identification that were previously noted. We're particularly interested in it by region, age, school-based information, and behavioral and mental health access, because people with developmental disabilities deserve mental and behavioral health access as well. So that's our regional map. I have Kids Mental Health Washington and HCA and DDCS all partner. However, in DDCS, there's 3 different regions. This is the first region here. Nicole was on for a second, but she had to jump off. Her name is Nicole Smith. She's the behavioral health specialist in that region. And then in region 2, it is Christopher Edwards, who was also on. He's out today, or wasn't on, but he is out today. That is his contact information. And then Donna was with us for a minute. I'm not sure if she's still here, but she's the contact for region 3, as you can see. Yeah, that's south of Tacoma, or south of Seattle, excuse me. Hi, Donna. So real briefly, we use the information to guide program direction, to make change, but it's also worth noting on the ground, families will see case resource managers, youth behavioral health specialists, and on occasion myself, the program manager. It is still worth noting that the family will have the case resource manager be the person that attends the MDTs. They're responsible for the majority of the action items. However, the Kids Mental Health Washington teams will often work with the behavioral health specialists that I just noted. So just note that you'll see both of those and that the case manager is expected to attend. In addition, the good work that happens within DDCS, these behavioral health specialists, they attend all the steering committees, they are in the multidisciplinary team meetings, they attend learning collaboratives, they give trainings both inside and outside of DDA to Kids Mental Health Washington teams. And my role is to attend and support them in that and make sure that we have that we are telling our story to the legislature about how individuals with developmental and intellectual disabilities need these supports. We're proud to see and the Kids Mental Health Washington team. So please reach out to those people if you have questions.
Great. Thank you, Dennis. And I think story is a great way to end us out. Is we really wanted to provide the concrete examples of what the work looks like besides just the numbers that were on the screen earlier. So these are some of the examples to just supplement what's been shared. These are direct impacts that happen to and with families at the community level, just to inform systems, and then just the recognition by people and partners about the resources available and just the impact Kids Mental Health Washington's having across the state. What's important to us is that we want to use this data, which you heard from our teams and our partners today, of being able to make an internal and external value for Kids Mental Health Washington. And we want to make sure we're doing it in alignment with some of the big initiatives. I know I saw in the chat questions about the Children Youth Behavioral Health Work Group. There's also the Washington Thriving Strategic Plan. And we're doing it in partnership with other big names that are out there already, like the Child Long-Term Inpatient Program, our friends at FISPERT, our YART program. So we want to make sure that we're not just doing this in silos. I know that we're running over, so I'm happy to answer any Q&A by making my email available. But I'll just close out with one more thing of that. We've got one more webinar coming next week where we're going to talk about what it's taken adaptively and technically to expand a program statewide. So we've got information there. We'll drop that in the chat so that people are able to register for that. And then we just want to say thank you. If you want to get connected and being a part of our work, we're going to drop our statewide program link in here so that you can get connected. Right on the homepage, you'll see a map of Washington State that will link you directly towards the regional contacts. So I just dropped that there. But thank you so much for being here today. Very grateful to have you. And I'm going to drop one more thing in the chat so that people have information about evaluations, how to get the PowerPoint slides. I saw a lot of requests for that. And we will let you go. Thanks to everybody that hung on there today. Appreciate you.